Williams, Adult and Community Services Manager for the Columbia Public Library, part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn, where we'll be learning about mental health for older adults. Today's Lunch and Learn is co-hosted by the library, the League of Women Voters of Columbia Boone County, and Children's Grove. Before we begin our program, just a couple of the usual Zoom housekeeping items. If you want to ask questions of our presenter today, use the chat feature. Again, you can just hover over your Zoom screen with your mouse, or if you're on a tablet or a phone, you may need to tap in the middle of your screen to see those options. Just click on the chat speech bubble there and type your question. We are recording today's presentation, so it will be available in the next day or two on both the League's YouTube channel and the library's YouTube channel for future viewing, and I'll put those links in the chat as well. Now I'd like to welcome our moderator, Maurice Scala, the new president of the League of Women Voters of Columbia Boone County. Thanks so much.
Thank you. Thank you very much. And we so much appreciate the collaboration with both the library and with Children's Grove on this program. Well, I'm delighted to introduce Vanita Khanna to you. Vanita has been in the mental health field for at least 20 years, and she works on substance use, dual diagnosis, and trauma with families and adults. She has lived in Columbia for 23 years with her husband and 2 children. Her husband is an engineering professor at Mizzou. Her older daughter is a psychiatrist, and her younger son is currently a medical student, so quite a family. Vanita graduated with a master's degree in counseling psychology from Mizzou and currently is the Access Center supervisor at Burrell Behavioral Health. Previously, she was at Preferred Family Healthcare at the Jefferson City adult site for 10 years. And she also holds credentials of licensed counselor, SATOP qualified professional, and registered alcohol and drug counselor. Vanita is a commissioner in the City of Columbia Substance Use Advisory Commission, and she's a board member of Children's Grove. And she was also one of the leaders in the grassroots effort for passage of the quarter-cent sales tax that created the Boone County Children's Services Fund. So it's my pleasure to introduce Vanita and let her get started.
Thank you, Marie, and thank you, Lauren and Kim. And I would also like to welcome everyone here today. And it is my privilege that I got this opportunity to talk about our mental health needs for our older population. So as we get older and our physical health evolves, our mental health needs evolve too. So with changes in physical health, technology, isolation, especially during COVID time, so that pandemic loss and fear of stigma, it becomes more important than ever that our senior population has access to mental health services. It is important that we are mindful of their unique needs and that we recognize the connections between mind and body. So by providing individualized care based on their needs, their preferences, and support system is very critical so we can optimize their quality of life and outcomes. So I'm going to kind of go over my next slide that if some of you don't know, day after tomorrow is National Older Adults Mental Health Awareness Day. So I felt that timing is absolutely perfect. Next, I'm going to show you a clip of one of my favorite shows as I was getting ready to put those slides together that I used to watch when I was in late 20s and was able to understand the importance of being close to family and friends who really need us the most.
Come in. Oh, Dorothy, I'm glad you're home. You got a minute?
Sure.
Good. For shaming a song.
Ma, I need to talk to you about Alvin. He's sick, Ma.
Talking about you've never even seen him.
I've seen him. After you had that fight, I was worried about you, and I followed you to the boardroom.
That was you? Thank God. I thought Gino the enforcer was out on parole.
Now, please, will you let me say what I have to say?
Maybe I don't want to hear what you have to say. Maybe I'm happy not knowing anything.
Or maybe you know already.
I'm not stupid. I could see there was something about Alvin that wasn't right.
Mahi has Alzheimer's disease. I met his daughter down at the boardwalk. She said that when he first started wandering off, she followed him everywhere. She took a leave of absence from her job so that she could take care of him. But she's not going to be able to afford that much longer. The family's discussed sending him to New York. He has a nephew who's a doctor there and can give him special care. And Ma Sandra says that within the next couple of months, they're going to have to do that.
You know, Dorothy, people think if you live to be my age, you should be grateful just to be alive. Well, that's not how it works. You need a reason to get up in the morning. And sometimes even after you find one, life can turn right around and spit in your face.
I'm sorry, Mom.
Few months, huh? Should give me enough time to finish the scarf.
Huh?
Dorothy, how long have you been here?
A while.
He's not coming back, is he?
No.
It was a nice couple of months. I'll miss him. Think he'll remember me?
I don't know.
I'll remember him. I finished the scarf, you know.
Oh, okay. Listen, next time we go to New York, maybe you'll take it to him.
Nah, I think I'll mail it. That way, I'll always picture him right here on the boardroom. Hey, someone's sitting there.
My favorite clip. I just love that communication between mom and daughter. And also we notice loneliness, loss of friends, partners, how it feels, caregiver burden. We're not able to provide care that person needs. Moreover, one thing that got really made me thinking that how the person who has lived for a long time at a place for years has to move to a new place with new faces. Okay, so now we are going to talk about briefly about the stages. Why do we need to understand each stage? Human being goes through stages, and of course you cannot choose stage or escape any stage or get double promotion based on what you want. Each stage comes with its own accomplishments and of course challenges and barriers. And with this unique needs arise. And as a human being, we get this chance, that opportunity to experience those accomplishments and challenges. So we are going to talk about very briefly about the stages. So we are taking this circle. We all know that strong and healthy, right there, physical and mental health goes long way until we take this full circle. We'll talk about this later in this presentation, what we mean by taking this full circle. So our next stage is childhood, where child could need help with schoolwork, guidance to navigate life from adults around them. And of course, they need more structure and may still need someone hand to hold. So we are going to go and quickly look at early adulthood. Same common theme: support, love, affection. And then later life happens. We'll spend some time talking about this stage in next few slides, along with video clips that will hopefully help us to take away some points here. So let's look at the physical changes. There is no way that some of those physical changes are going to be there. And it could be expected high blood pressure, change in cholesterol level, vitamin deficiency, calcium, low calcium level, or arthritis. And again, we go through those changes. And then we get to the next aspect, the physical changes and then mental health changes that happens with the same time. The difference is physical health changes are visible, such as wrinkles, as you can see in that picture, gray hair. But when we talk about mental health for our golden population, most of the time they don't think there is a problem because this was not as openly recognized a problem. I would like to share, I feel this is a safe place where I would like to share one of my example. This was a few years back in a mall in St. Louis. As I parked my car and I noticed a lady, probably I would say in early 80s, was trying to take a bag, big bag, heavy bag, seemed like a heavy bag out from her car, which later I noticed that was a comforter set that she brought to return or exchange. So by the time I say anything to my son, he was already asking the lady, do you want me to take this bag out for you? So those visible, obvious needs made him to offer help. Whereas if a person who is very anxious driving into the huge mall parking lot with a very narrow parking size, I wonder that if somebody would notice or offer support or help. So I feel that this is where we need to be aware of, and we'll talk about some of those mental health common disorders that we see. And first of that is in depression. And I'm not going to go ahead and do a lot of data, but just to kind of give you a brief, 11.5% who are hospitalized or 13.5 requiring home health may not due to the problems at the hospital, but could be due to mental health needs that were not recognized on time. So this is the data from National Counseling on Aging. Next, I would like to talk about risk factors for depression. Again, the National Council on Aging, some of the risk factors contributing to depression. This is a very busy slide, so I will probably give you a moment to read and absorb. As you can see, there are many factors that can cause depression. However, not all factors affect everyone equally. And a quick example where I went through and realized that how important it is to recognize depression. This was in 2018, and I flew to India to attend a wedding where my mom fell and broke her hip bone. She was taken to the hospital. They did the surgery, very successful surgery. And I remember when I was ready to come back, I talked to her, and she was actually receiving physical therapy while she was in the hospital. After 2 weeks, I came, and after 2 weeks, I got a phone call from my sister that mom is asking for you. I don't think we have enough time. And I came to know that she stopped eating, refused to open her eyes. And doctors were not sure what to do. Her vitals were great. She was recovering, but just suddenly she just decided to give up. And I decided to flew back again and was very confident that I'll go there and I'll wake her, but nothing happened. After 2 days, I asked ICU that if they will allow me to just sit with her more hours than what they have as a visiting hours. And after a day, as I was talking to her, and she was kind of in a coma, and I started talking about, she used to make homemade chips. And I started talking, Mom, we need to go home so we can eat chips and drink tea together. And I saw a moment in her eyes, and she opened her eyes and just started crying like a baby. We still don't know the reason. She woke up, and after a week, she was discharged from the hospital as nothing happened. That experience really made me feel that how important it is to be with someone, holding their hands, talking to them, making sure, letting them know that you are there for them, can bring someone back. So my next slide is symptoms about depression. Again, busy slide. It can be harder to detect and diagnose in seniors, since, as I mentioned with my example, it often shows up differently in older age groups compared to younger ones. For example, fatigue can be easily attributed to old age. What's more, the cognitive changes associated with untreated depression are often mistaken by dementia. Another example, as working at Burrell, we see kids also that decreased appetite in younger patients much more likely be to seen as sign of change in mental health, but then an older adult where change in appetite may be wrongfully attributed to age and left at that. Next, I'm going to talk about anxiety. According to National Counseling on Aging, they say 4% of the older adult worldwide. So this is more kind of a reported number. And I wonder if it's little more than 4%, but other risk factors could be safety, security, driving in traffic, bigger cities, low self-esteem, low confidence in our daily living functions can be another risk factors. Next, we'll talk about the symptoms, how to recognize. So there are some symptoms, well-known symptoms. They can be manifest itself in many ways, as shown in the slide. Some examples, as I was thinking about, as we see our clients with anxiety disorder, some of those examples I see more kind of something is wrong and nothing will work out for me, or leaving home for groceries, but could not stop thinking if I lock my door or if I turn the burner off or not, or taking a wrong exit, very common, and thinking I will never get back home safe as I may not have enough gas to reach home. Not able to relax while watching a movie or reading your favorite book. Not able to remember special dates, such as kids' birthdays, anniversaries, and later feeling sad and guilty about it because this never used to happen before. So what happened to me? Not able to sleep and blaming pillows or room temperatures or the weather. Bad dreams or seeing your late partner in the dreams. Not able to do your routine activities that were practiced for many, many years in the past. Not able to trust yourself, or low confidence, low self-esteem. So now we'll talk about physical signs, as sometimes people get confused. For example, if they are having heart attack, or is that the social anxiety or panic attacks? So while symptoms are an important aspect of diagnosis anxiety in older adults, even more critical is how these symptoms affect day-to-day. Anxiety is considered problematic when it interferes with our daily functioning, your quality of life, or even your overall health. We do our GAP scores that kind of helps us to kind of measure their level of functioning, which really helps. Moreover, with age, it is harder to tell if symptoms are related to underlying physical conditions or really anxiety. Next, I'm going to talk about suicide according to the National Council on Aging. The third one, that kind of was something very eye-opening as I was looking at the data. Among people who attempt suicide, 1 in 4 seniors will succeed compared to 1 in 200 youths. Big difference. Here we have the 4 Ds that contributes to suicide risk in older adults. Depression. It is not depression that is depressed mood, as I was sharing the example from my mother, but it's a clinical depression. Debility, when chronic illness starts to impact on the person's ability to do things that are meaningful or relevant to them, such as hiking or traveling or swimming, anything that they have enjoyed the most. Disconnectedness. We have seen that in last 4 or 5 years, loss of opportunity for social interactions. So become isolated, and deadly means. They say 75% of older men take their own lives using a firearm. And that study is conducted at the Rochester Center for Study and Prevention of Suicide. Little old in 2016, but I thought to kind of share those 4 Ds. Let's look at warning signs as we look at the data. Loss of interest. Again, giving away beloved items or changing their will. And I'm going to show you the clip that kind of brings that. Avoiding social activities, neglecting self-care, grooming, preoccupation with death, lacking concern for personal safety. Let me bring back to the clip from my favorite show.
Hi, pussycat. Okay, I said I would. Come in. Come in and sit down. I have something to show you. Look, 10 carats and not a flaw. I bought it today on time. Very nice. Look, I was thinking, maybe you shouldn't go through with this. I have to go. I've never felt so happy. Do you like the ring? Reminds me of a doorknob I had back in Brooklyn. What are you doing? Just my way of saying thank you. Well, I think I've taken care of everything. Now, you see to it that they don't put lipstick on my teeth. Don't worry, I'll take them out and check them personally. So, I guess it's time to go. You will hold my hand. Sure I will. I'm so glad I don't have to go alone. You remember how we met? Yes, about 8 years ago. We shared a room in the hospital. You had the heart scare. I was the gallbladder. They gave you my sponge back by mistake? You ate my Jell-O. It was a horrible little room. We couldn't wait to get out of it. Because we wanted to live. Yes, I remember. Remember better. Remember life. I don't have much of one. I'm not like you. You live with friends and family, holidays and warmth. I hear the silence. We'll talk. We'll talk all the time. You can come over Thanksgiving, Christmas, every Friday night. I may not be there, but you could always talk to Rose. No, I want to go. Lydia looks so peaceful. We're not in this life for peace. You're crying? No, I'm not. I don't cry. I can see your tears. And I can see yours. You know what that tells me? What? You're not as ready to die as you think you are. You still want to live, kid. Some kid. I don't know what to do. That's the point. If you're not sure, you can't change your mind tomorrow. You wanted me to be here for your death. How about letting me be here for your life? Like a friend. Like a best friend. Darling, honey, sit down. Pacing ain't gonna help. I just can't stop thinking about Mom. Look at that. Perfect. 98.6. Yep, this is what it looks like to me. Thank God, that means he's better. Yeah, I'm pooped. Oh, I guess there must be a reason why women have babies when they're 20ish instead of 40.
Blanche, the only thing in this room that's 40ish is your hairdo.
Oh, it's okay. She changed her mind.
Oh, thank God.
I know, Dorothy. I know. Oh, that must be the little strands.
Frank, we love you, but you are out of here.
Give me a minute.
Sure.
Listen, you're just starting out. You're in for the long haul. Keep your seatbelt on. There are lots of twists and turns. Stop that, or they're going to come in here and sing again.
So there are a number of things I would like to highlight from this clip. How her daughter, Dorothy's mom, how that daughter's support helped mom to help her friend. Another statement that I hear the silence. And how friends and family can help inviting and making sure that they are there to help. Another additional contributing factors I wanted to talk about is the isolation. So there are fear of losing friends, as we saw, financial dependence, communication breakdown, less driving restrictions. Another reasons that we need to look at is less engagement nowadays in worship houses, living far away from family and friends. Think about average, how much time do we spend in person with our families and friends nowadays? I would like to share one of the report that came actually last week that was issued by Surgeon General about the isolation and loneliness are becoming an epidemic in US. So this video quickly is going to illustrate what we are talking when we say isolation. I'm going to come back. Wanted to make sure they work right. Another piece is technology. I do not know if you have experienced, but I heard many times when I asked my son to help me with anything, that very simple statement, "Oh, Mom, this is something so simple, and you do not know." And my answer is always, "I don't know, that's why I'm asking." So much harder for older population to keep up with evolving technology. And of course, COVID, that made it worse. We have now, visitors became very limited in order to prevent spread of COVID. I want to quickly go over, this was in 2020. I was working from Berrywood office that is opposite to Women and Children Hospital. And this was in summer when I noticed a family in Burrell's parking lot standing outside of their car and waving to the hospital window. It took me a minute, what's happening? But then I noticed that there was a patient standing inside from the window, and I quickly realized that this family wanted to see the face of their family member. Even it was from distance, but they just wanted to see them and kind of wave them. Stigma in mental health, very different today as it was in the past. There are no doubts that there is a significantly decrease when we talk about stigma in mental health, but we have to still say that it is still present in some shape and form in our society. Let's talk about the solutions. What are we missing? There is nothing right or wrong what we did, but if things did not work, we need to do something different. Going to the church, bingo, picnic, music, dance, or any physical activities that you have enjoyed or that you still enjoy. Even if you cannot perform, watch your friends, lift them. I think supporting others, lifting others can also help to decrease our symptoms and make us feel more kind of a productive citizen. So one of the message I would like to give, this is a full cycle, as you can see that where we are going back an opportunity to live a fuller life. So even it's wearing diapers again, need to be held, need to be fed. We need a pat on our backs to birth. We need help to learn to walk again. Love, support, nurturing environment keep us physically and mentally healthy. So let's pause here for a moment and think the role of getting safety, as we saw a few clips, love, attention, support. It's very important. And that strong and healthy physical and mental health goes a long way as we accomplish and complete this full cycle. So I had put some sources that I have used, those YouTube and some images. And let me go back and see if I can play this Surgeon General interview. Okay.
New and existing customers can choose the phone they want, like the incredible iPhone 14 on us.
Not to brag, but I'm on Verizon now. And I got to choose the phone I wanted for free. Not that you're bragging.
Choose the phone you want on us. Verizon.
Walking clubs are taking on, and it's not just the exercise.
You're connecting with someone, which is something that I was kind of missing.
More and more people are missing that connection and are feeling lonely.
The pandemic poured fuel on a fire that was already burning.
Dr. Vivek Murthy, the U.S. Surgeon General, says loneliness is an epidemic, the focus of an 80-page advisory he is releasing today.
We're used to thinking about smoking and obesity as clear public health concerns.
So you're saying loneliness is comparable to smoking in terms of the detriment to your health?
Yeah, in terms of the risk that it poses for premature death, yes.
Half of U.S. adults experience measurable loneliness, and it's greater among young adults.
When you struggle with loneliness, when you're socially disconnected,
It increases your risk of depression and anxiety and suicide, but it also increases your risk of physical illness as well.
Loneliness increases the risk for heart disease, stroke, and among older adults, dementia. The cure, Dr. Murthy says, is not only personal change, but societal change as well.
What we need to do is actually rebuild social infrastructure in our country.
We're talking about changing the social fabric. That's been decades in the making.
It's been decades in the making, but it's also something that I'm confident we can address when we put our mind to it and if we act together.
Among his recommendations, a focus on community organizations, mobilizing the health sector to raise awareness, and reconsidering how we use technology.
In-person matters. Connecting online has its place, has its value, but it's not as
I mean, it was very difficult, but I knew how important it was. I knew in my gut how important it was to make them not feel like they're helpless or not feel like they are past their prime and they're, you know, we shouldn't spend time with them anymore. I mean, the love that we need to show them is vitally important. No matter how they're acting toward us, we need to show the love as best we possibly can. And as far as Children's Grove is concerned, we are very interested in spreading kindness and civility and inclusion, and to have a positive impact on especially youth mental health. But one thing I think is important to realize is we talk a lot about inclusion as far as race and ethnicity and sexual orientation, but I think we also need to talk about inclusion as far as older people. I think there is ageism in our society, and the more we can show the respect we need to show toward older people, it's a value to us as well as to them. They're walking encyclopedias. They have so much history in their knowledge that I've always loved working with older people and sitting down and just asking them what life was like when they were younger, and to tell us about what current events were happening when they were younger. And it's just, they're fascinating sources of information, and they need us. And I think we all need to make it a priority for people in our lives to show them the care. And hopefully that, I mean, part of me kind of hopes that my kids saw that and will respect me when I'm getting increasingly old. But it was a good lesson for them, because now they certainly are very respectful. And so all those things, we can be good role models for our kids and good role models for the adults the older adults in our lives. But that's really, I mean, we spent most of our time in Children's Grove with youth. And that's why I was so glad Vanita was willing to do this program. And she came up with the idea, and I think it's great because we want to be kind to everyone. And so this is the perfect example of that.
If I can kind of follow up on that, I think it's also been proven to be very beneficial to people to be kind to others and to help others, that can enhance our mental health at any age or stage of life. And given that many of us older folks have time to dedicate to helping others, I think we need to recognize that that's a very important avenue that helps enhance our own mental health as well.
Yeah, that's an excellent point. There is literally scientific research out there showing that our mental health improves if somebody is kind to us, but our mental health also improves if we're kind to someone else, or even if we witness somebody being kind to someone else. And so that it's in our own good, it's in our own best interest to be kind, because it's going to make us feel better.
Well, Vanita, welcome back. We're glad to have you back. And I'm referring to the chat. If folks have questions or anything that you want to follow up on related to this topic, please post them in the chat. There's a question from Sarah Greenlee she says, thank you for sharing your personal experience, referring to you, Vanita, What are your suggestions for getting doctors to consider depression and anxiety as health conditions are discussed? As you mentioned, symptoms may be mistakenly attributed to physical health. Do doctors receive much training in the mental health needs of seniors?
That's a great question. And I communicate with my daughter, who has in a third year in psychiatry. And I ask her sometimes, we hear that very easily misdiagnosed at times. I think, to answer your question, more education, more groups that we encourage individuals to join, exchanging their experiences. We can talk about the data, and yes, data is important, and that helps us to know which direction we need to go. But at the same time, I think when we look at those presentations or when we read books, personal examples, personal experiences, they really help us to remember and also kind of help us to know the options, what we have. So again, communication, getting out, talking to friends, family, and when you are visiting your doctor, asking questions based on what you have learned, preparing yourself. I think that's very important.
Are there, as a follow-up to that, are there ways that you would suggest if we are, for example, taking an older family member to a doctor visit? Are there ways you can suggest that this could be brought up if it's a concern? Because in my experience, people who are older than I am, like a generation ahead of me, don't raise these concerns on their own necessarily. So do you have any suggestions for that situation?
Sure. As I did mention, stigma is still there. Yes, it has significantly decreased. I will always respect the person. I would always first check with my family member and would ask, what if we talk about this to your doctor? What about, you think that if not today, how about the next visit? Are you comfortable? I will always encourage the person to talk to the doctor rather than bringing any concerns or anything that other family members are noticing. And of course, if the situation is where we are looking at risk, if we are looking at the person who feels that there is no purpose to live, that's where I would encourage the family member to talk to the doctor, but with the family member who is going through that. So the idea is not behind, idea is always with, encouraging the person first. And if the situation does not allow us, then we talk to the physician with the family member.
Okay, thank you. Are there any other?
I would add one thing to that, and that is whether it's a mental health issue or a physical issue, I think it's so important to have a family member or just somebody who can advocate for the patient to go with the elderly person to the doctor. There were many times, especially my father, who was extremely hard of hearing. The doctors would not talk loud enough. And I would say to them, you need to talk louder, and they still wouldn't. And so I would then repeat what the doctor said really, really loud so my dad could hear it. But I think we all need to advocate for the elderly, no matter what the medical or mental issue might be. We need to be there for them to help advocate with them, like Vanita said.
Kim, thanks for bringing that. I want to think about a person who is holding a stick or walker versus a family member who is holding that individual's hand. There is a great power there, where we have a person who can understand if hard hearing or any type of limitations, having a family member just present there, it makes a big difference.
I have another question in the absence of questions in the chat. People, please feel free to speak up via the chat. I am wondering how important intergenerational experiences are. I mean, we've talked about that now in the medical setting, and that point is very, very clear. But just in terms of maintaining function and maintaining happiness in life, how important is it that we have contact with people of other generations as we get older?
I think just communicating with other generation, it's always the learning from both sides. So if we can learn something, it's just like computers and new phones. I remember my parents used to wait for my son to come and teach them how to do those. Very nice communication from both sides. Kids are learning, respecting their grandparents or parents and feeling good about that they are able to teach something and they're getting that appreciation that gives them self-confidence and good self-esteem, kind of act of kindness. Back to our mission from Children's Grove. And also the other side, just feeling strong that I have someone that I was able to communicate and I was able to learn how that phone works, and I will be able to get back if I have any questions. So I would say both sides, and I think it is important just for a healthy family to have that communication open and more frequent.
I guess I would add that that many people, unfortunately, these days may not have real frequent contact with family in person because of distance. All of our grandchildren live 700 miles or more away. But getting help with technology so that you can stay in touch with the people you care about is so important. And it's also possible to connect with, if you have no children or grandchildren, it's possible to connect with kids in a lot of different ways in the community. You can volunteer to read in an elementary school. You can volunteer at a preschool to help out. I mean, to me, just being around children is a very positive thing in life. We have a question in the chat now. David Luthold is asking, a friend is very negative about most everything. How do I help?
So first of all, I think when we say negative, it's a wide area where is that the specific any incident or any event or any situation that is making this person very negative. We have to look at sometimes it's just me that I feel that there is a negative interaction, or is that person is having trouble with people around that person that he or she is negative. So we have to look at both sides, that where this negativity is coming from. Is that to one specific person, or is that to the whole family or friends? And then we look at what do we need to do different. Having open communication always works better. I know there are times where in therapy, I hear from the providers, should I tell her or should I not say? Well, if there is a communication, if there is a dialogue, if there is a therapy session, we should be very open, very transparent, and we can address that before the session. Hey, this is where we are here. This is we are going to work on. So to answer that question, how to help that person is, I think we need to find the reason. We need to look at that, is that towards one person, or what is causing that negativity, if that it is negativity.
Yeah, I would add that sometimes, like I also know people who are responding very negatively to change in the environment. It's not about interpersonal. It's not that I'm mad at so-and-so. It's that they may feel like, for example, climate change is inevitable and is going to affect so many things, or just difficulty adjusting to the constant change that when I was younger, I might have looked at and said, oh boy, something new. And now I tend more to look at it and go, oh no, something else, something new that I have to learn, or I have to find a new product because my old one was discontinued or whatever. And that can, you know, David's question was, this friend is very negative about most everything. And so are there ways that we can help guide friends or relatives toward the kind of help that you're discussing?
I think one of the things, if I have to say, giving the examples, bringing those examples and having the conversation, more successful examples, and also how that negativity, that person's negativity is interfering in the communication, and how that negativity is impacting that person. So as a human being, sometimes we are very much focused on our happiness, our what we feel. So one of the questions I would ask, you know, we are noticing that for whatever period of time, tell me how this negativity is helping you. Because I see you are sad, you are emotional, you are crying. How is that helping you? Why you are keeping that so close that we are not able to communicate with you? How can we help there? Why is it something that you are keeping close? Because as a human being, we try to do things, we try to keep things that we enjoy, what we like a change. At one time, you know, we like you were saying that, you know, now I feel like, oh my gosh, another change. Very normal. But what do we like about it that we are feeling that way? If we don't, then we can put aside. Now that thing may not go away, but at least we are not holding that on our shoulders, which is much better than keep it aside. So I think asking that question that, you know, this, whatever the emotion, the anger, how that negativity is coming, what do you like about it? Well, I don't like anything about it. Then let's try to do something different, because you and I both agree that we don't like that negative behavior or, you know, anger or whatever that emotion is.
I'd like to add something too. I think that one big reason why, well, there are two big reasons that immediately come to mind on why the elderly might be negative or depressed. One is the death of a loved one, which is bound to happen, and the other is their own death. And so I guess I want to throw out how important faith can be, and you know, so to reach out if they have a church or if they have a religious leaning, to find somebody from the faith community to help them through that, especially the process of knowing that, you know, your health is failing and death is inevitable, maybe fairly soon. To we've been talking about, you know, professional counselor, psychologists and medical people, but I think the faith community might be somebody else that we would want to tap into. It may not work for everybody, but I think there are certainly people it would help.
Thank you. That's an important point. I think we're getting down to very close to the end. I just want to draw people's attention to the notes that Lauren posted in the chat, reminding us that the library has all kinds of opportunities for both to connect and socialize, and also for people to learn to use technology so that they can connect with their loved ones or their friends. So, and she says, we have device advice and tech help drop in on Tuesdays and Friday afternoons. And then she's posted a link to, you can always go to the DBRL website and click on events, and there are just all kinds of opportunities for afternoon classes and book discussions, etc. So wanted to make people aware of those resources.
I appreciate that. And if I could say one more thing, we actually have, it'll be another year or so from now, but we're part of a grant that will allow us to do some creative aging programs through the Lifetime Arts organization. And it really is about teaching older adults skills and mastery around a certain artistic skill. And it really, the research around the benefits of mental health and making those social connections with these classes, there's a lot of research. So we're excited about that. So stay tuned.
Great, thank you. And thank you so much, Vanita, and thank you, Kim, for all of your excellent advice and information. We appreciate it.
Thank you, everyone.
Thanks for joining us. And we are taking a bit of a hiatus for the summer, and then we'll be back with more Lunch and Learns in the fall. And we're working on being back in person or doing those hybrids. So stay tuned for that. Thanks, everyone. Have a good afternoon.
Take care.